Good morning. Welcome back, students. Today we'll be talking about organization of the thoracic cavity. In this cardiopulmonary block, we are dealing with the structures which are enclosed within this thoracic cavity. So we need to understand all about the thoracic cavity. So the objectives which we'll be covering today, these objectives will be, first of all, I'll be looking for the surface anatomy of the thoracic cavity. In a real human body, how things are. And then we'll be looking for different bones who contribute in making my thoracic cavity. And then we'll be explaining about features, bony features of ribs and the vertebrae and the sternum. And then we'll talk about the lines. What lines? These lines are really important in understanding different, in interpreting different in clinical perspectives. And then in the end, we'll be talking about a very important content. That concept is about mediastinum. So we'll be looking for that what is mediastinum and how it has been important and relevant for our discussion today. So with this, I like to start with. So what are you looking at? You're looking at a human body. It's a male human body and you're looking from the front. So now in this human body, there are certain bony landmarks and these bony landmarks are important. But now, what are the structures which are under the skin and the superficial fascia? So we have, when we explore down, we can see the ribs and then the whole rib cage. And this rib cage is not one bone. These are the multiple bones which has been connected by different type of joints, and they are the one who makes my rib cage. So now, why we are talking about? Because my heart lives inside this rib cage. And you're looking at the different borders and the surfaces of the heart, and this concept we'll be learning in our upcoming lecture sessions. You'll be having a sequence of lectures there. You'll be learning about the external features and the internal features of the heart. But for understanding all that, we need to have a good knowledge of its relationship of what? Relationship of heart with the bony cage. And then what are you looking at now? I have removed those border and lines. Now we are looking at the great vessels, those who are leaving and those who are entering my heart. And these are important because my heart is a pump and I have double type of pumping of blood. One is for pulmonary unit and other is for systemic unit. And then we have the valves. What are these valves doing here? So these are the location of these valves. But we listen to them in a different spaces. How I can know exactly? So to understand all that, I need to have a good knowledge of these spaces, and these spaces are called intercostal spaces, and how we can count them. It looks so simple, but it's not that easy the way it looked to us. And then the other features, you're looking at the lung fields. These are the lungs and my pleura, and you're looking at these are two different lines, and this is how these lines are important. And this is the place where we have the lung and its covering, which are called the pleura, is being seen from the front and from the back. And this is being in relation to this rib cage. Now let's start talking about the thoracic wall. Let's start putting up the ribs. So when we talk of the ribs, first of all, we need to understand what are these ribs and what are they doing for us. What do you think? What is the function of these ribs? Yes, you can tell me. Protection? Really? No. The primary function in human being, the ribs are helping us in what? In performing breathing. So breathing activity is all dependent on the movement of the ribs. Fine, protection is there, but not to the greater extent. Because if you look at it, the thoracoabdominal wall is the same structure. If you remember in your GI block, we talk about the layer, anterior abdominal wall you have done. And then we talk about three major muscles, and they were arranged obliquely, and one of them was the rectus. And now the same muscle arrangement is being visible here. But now these muscles has been pierced by these ribs. And these ribs, primarily in human beings, their prime job is they are helpful in performing the breathing exercises. So let's put the structures. What you can see here, you're looking at scapulae, sternum, and then you're looking at the costal cartilages. And then going further, this is my first rib, you got this on top. I'm using a word atypical. So what is this atypical? That we need to learn. And then, so this whole thing, the upper ribs, I call them true ribs. From rib 1 to rib 7, I call them true ribs because they have, you can see that, they are connected to the sternum by their own costal cartilage, but the lower segments they are sharing. So the one who are connected directly, the ribs who start their journey from the vertebrae behind and coming to the front and connected to the sternum directly, they are known as the true ribs. And those ribs which are going to the sternum but not through their own costal cartilage, we call them false ribs. And there are two ribs below which you cannot see very clearly in this image. These are not going to the sternum, so we call them the floating ribs. So this concept of true ribs, false ribs and floating ribs is important, and you should understand that. Now these are the lower ribs, we call them false ribs, and from rib number 8 to rib number 10. So these two ribs are there. And then, as I mentioned before, these are the floating ribs, and these ribs are not able to be connected with the sternum. Now, there are certain landmarks. So the sternum, so this part of the sternum which you're looking at, we call it manubrium. Manubrium part of the sternum, so we call it manubrium sterni. And then this is the place which is related to very important structures of the neck, so we call it the jugular notch. And these are the facets where my clavicles, they come and attach. And now, this lower part of my sternum, this big long part, we call it the body of the sternum. And what is this red line? Guys, this red line is really important. This red line is the junction between the manubrium and the body of the sternum, and it's a very important reference point, and it's really helpful. So what we call it? We call it sternal angle of Lewis. Angle of Lewis. So this reference point is helpful in counting the ribs, and when we are able to count the ribs, then we can count very easily the intercostal spaces, because while dealing with different pathologies of my thoracic cavity, the reference point is one, and that is this angle of Lewis, and this is important, and we have to, this is a task everyone who is dealing with the thoracic cavity, no matter for the heart or for the lungs, for the respiratory pathologies or for the cardiac pathology, this angle of Lewis is really important. How we can determine? You can feel your own. Put your finger just in front and you can feel this jugular notch. You can do it. And start rolling your finger down. The first elevation you will find, that is angle of Lewis, and this corresponds to what? Your second costal cartilage. So now, second costal cartilage, this is my second rib. A space above to that, between the first rib and second rib, I call it first intercostal space. And a space below to that, I call it second intercostal space. It's both on the right and left sides. And once we determine this angle of Lewis, then we can determine each intercostal space, then it will not be a problem. And determining these intercostal spaces is really important, and it has high clinical significance. Now, as I said, this angle of Lewis, it corresponds to my second rib through its second costal cartilage. And once we determine that this is the second rib, now it becomes very easy in counting, and that's important, as I have emphasized on that. So this has been explained how it is important. So now this lower end, which is conical, and that is given a name, we call it xiphoid process. And now this whole thing is what? The sternum. So sternum is a flat bone which is present in front of my chest wall, and the ribs are connected to it directly or indirectly. Those ribs who are connected to it directly, we call them true ribs, and those ribs who are articulating with that indirectly, we used to call them false ribs. And there are two ribs below, the rib number 11 and rib number 12, they are unable to reach to this part, and we call them floating ribs. Are we good with that? Now I have given a different color to this costal cartilages, and these are important to know. So they are primarily hyaline type of cartilage. And now this is what? These are the costal margin. If your patient is lying on any couch, so the part which you can feel are these costal margins. And now look at it. We are closing from above. So this is superior thoracic aperture. We call it superior thoracic aperture. And from below, if I close this space, I call it inferior thoracic aperture. Guys, a term you will be encountered a lot: thoracic inlet and thoracic outlet. Anatomists have a different belief and surgeons have a different belief. So for a simplicity, we can call it as this is the superior thoracic aperture and this is the inferior thoracic aperture. Because the surgeon and anatomist, they differ on these terms. One of them call it thoracic outlet, one of them call it thoracic inlet. So we should not get into those discussions. We should be more targeted that this is superiorly placed, so we call it superior thoracic aperture, and this is inferiorly, so we call it inferior thoracic aperture. But calling them inlet and outlet, that's a different story. We should not be engaged in those type of discussions. Both of them are right. So now this is our rib cage. Together they are making. Are we fine so far? Perfect. So now this is the clavicle. Why I'm bringing clavicle here? Because I have something really important. A line which goes vertically downwards. It starts its journey in the middle of my clavicle and it goes all the way down. Passes between the inguinal ligament. And this curve, this line, mid of the clavicle, we call it mid-clavicular line. Mid-clavicular plane. Guys, these planes are really important for understanding the thoracic structures and they are useful. And this goes medial to the nipple. This is the male example. So this is a male nipple and roughly plus minus it lies at the fourth intercostal space in males. And then there's another line which is dotted. What is that line? It corresponds to this nipple, so we call it mammillary line. Mammillary line. So when we'll be learning about the breast, we can see the ectopic breast can be found across this mammillary line. Those are unusual conditions, but the normal situation is this. Are we good with that? Now let's come on the real picture. So we are good with that this is the sternum, these are the clavicle, and these are the costal margin. Look at this. I'm sure everybody can say very clearly it passes through between the mid of the clavicle, so we call it mid-clavicular line. And this one, mid of the sternum, we call it mid-sternal line. And you remember MSK? Yes, anterior axillary fold. So we call it anterior axillary line. So the line who correspond to my axilla. So anterior axillary line. Then look at the person has raised his arm, abducted his arm. And now what you can see above 90 degree. So this is corresponding to my anterior fold of muscle who was making my axilla. So this line is anterior axillary line, and the one which is in the middle we call it mid axillary line, and one which corresponds to the posterior border of my axilla we call it posterior axillary line. Guys, these reference lines are really important, and if you are practicing the cardiac or respiratory medicine, you need to be good with these lines, because these lines meaning they have a lot of reference points, and we will be talking about these lines a lot during these 7-week time during this CVP block, and your concept should be really important. Now looking from the back, so it's in the mid, so we call it mid vertebral line, and this is between mid of what? Scapula, so we call it mid scapular line. So guys, we have learned how many lines? One was in front, that was mid clavicular line. 3 were on the sides, they were anterior, middle and posterior, yes, axillary lines. And then on the back we have mid scapular line, and in between we have mid vertebral line. So these lines are really important, and you are expected to be good with these lines. Now let's start talking about the vertebrae. This is the skull and this is the mandible, and look at it. These vertebrae, they are not straight. These are the small bones which have been joined together, and they have been given a different colors. So the uppermost chunk, this is the cervical vertebrae, and they are 7 in number. And then this green one, which will be dealing a lot here within our this CVP block, these are the 12. There are 12 number of thoracic vertebrae, and these are shown in green color. And then this lower segment, we have learned about that. These are the lumbar vertebrae. We'll be talking in more detail in the renal block about these lumbar vertebrae. And the lower segment is the sacral vertebrae. They are the 5 vertebrae. They fuse together. And the lowermost segment is the coccygeal vertebrae. Are we good with that? Now, we can see from the different views how these vertebrae will be visible to you. Look at it. when we were born, a baby, have you ever held a baby in your hand? It's like a sponge, so soft, and look, the vertebral column is C-shape. But what happens? When the baby learned to crawl, this was C-shape, so primary curvature was C in embryonic life. But when first the baby start to hold his neck, so there a curvature appears. So thoracic curvature appears. It's a primary. And this one is sacrococcygeal curvature. So if I broaden up this thing, the primary, so they correspond to primary. But when the baby learn to hold his neck, so we have another curvature which appears there. This is the one. Cervical curvature. Secondary, and this one is lumbar, that is also secondary. So this is how, once we develop these, once we have this curvature, then the baby learn to hold the neck. And once we develop this curvature, then the baby learns to walk. And these are important. And these curvatures are really, really important. Look at it. The beginning was a C, a primary. So these are primary. They were concave and these are convex. Remember? Concave and convex. This concept is important and you are expected to be good with that. From an embryo to an adult, this is the transition. And that's important. If anybody, any person, any human unable to get these curvatures, these secondary curvatures, that person cannot stand, cannot perform anything. That's important to know. Okay guys, so now let's proceed with, so this is the gravity line. Now look at a vertebrae. Any vertebrae of our body, these are the basic ingredients. A typical vertebrae. What does it contain? So these are the different structures which together join and then they make a vertebrae. So what is that? Number one, that's the body. This number two, we call it pedicle. Number three, lamina. And number four, they are making what? An arch. Right? So vertebral foramina. Why we need a vertebral foramina? Because the spinal cord is being kept in this vertebral foramina, and who makes it? The pedicle and lamina together by an arch-like structure. And then this number five, it's an attachment for the vertebrae above. So we call it superior articular process and a facet because it articulates with the vertebrae above. And then it's its lower end and we call it inferior articular process and a facet. Are we good with that? So there we can see in this image the same structures, they are visible here. You can see the body, you can see the pedicle, you can see the lamina, you can see this superior and inferior articulating facets. And this is the intervertebral foramina. This is the vertebral foramina and this is a space between the two vertebrae, so we call it intervertebral foramina. Are we good? So this number 7 is a facet, which is again for articulation. What is number 8? It goes transversely. We call it transverse process. It goes transversely. So this is the transverse process of a vertebrae. And number 9. It's like a spine, so we call it spinous process. Are we good? So these are the ingredients of any vertebrae of human body. These are modified according to the location. This is really important and you need to be good with this concept. So now look at it. The spine, the laminae, they are joining to make what? They are making an arch. We call it neural arch. Why we call it neural arch? Because it contains the spinal cord. It contributes in containing the spinal cord in between. And then intervertebral foramina, guys, this is the place from where each spinal nerve emerges. You remember we talk about we have 31 pairs of spinal nerves. They come out, they branch off from the spinal cord and they emerge between the two vertebrae. So there is a foramina on the side. It's formed half by the vertebrae above and half by the vertebrae below. So together a foramina, you can see the half of it. When I put a vertebrae below, so this will become an opening. At the moment it's an arch. So this is the intervertebral foramina. Now, we have ligaments. A ligament which goes anteriorly, we call it anterior longitudinal ligament. These are the names. So that was anterior, so this must be posterior. And then it is inside the arch. We have a name for that. What's the name for that? We call it ligamentum flavum. It's a name. and then between the spinous processes, and that's called interspinous ligament. And connecting the spines, we call it supraspinous ligament. Are we good? And then intervertebral disc. You heard of this term disc. Oh, that person has a disc slip of disc has been slipped out and all that. So this is that disc which is working as a cushion, and it's present between the two vertebrae. Are we good? Now let's talk about a thoracic vertebrae. Guys, thoracic vertebrae has different types. We have typical thoracic vertebrae and we have atypical thoracic vertebrae. What is typical and what is atypical? Like the classic vertebrae which belongs to my thoracic region, they are given the name of typical thoracic vertebrae, and there are certain others who are different. Why they are different? Because those who are close to my cervical vertebrae and those who are close to the lumbar vertebrae, where we are having a transition, they have different features other than a classic thoracic vertebrae. So this is how we can differentiate among them, because now when the time reaches when my thoracic vertebrae is becoming a lumbar vertebrae, it changes its shape, and the time where the cervical vertebrae is becoming a thoracic vertebrae, there it changes its shape. So these are important concepts and we need to understand these. So we all know this is the body of the vertebrae. We did it. These are the pedicles. You are smart, you know it. What is that? Laminae. And then the vertebral foramina. This is the spine, spinous process, transverse process, and then these are the facets for what? For the ribs. So facet for tubercle of the rib. And then what is that? Superior articulating process, and these are the facets. And similarly vice versa. So on the body of this vertebrae, this is classic of a thoracic vertebrae, because we don't have ribs in the cervical region, we don't have ribs in the lumbar region, we don't have ribs in the sacral region. So this is impertinent for my thoracic vertebrae. So I am having more facets which are present on the sides of my vertebral bodies. So these are for what? Superior demifacets for head of the rib. So demifacet. It's not a full facet, it's a demifacet. And then now you can see there is a superior and there is an inferior. So we have superior and inferior demifacets for the head of the ribs. How they articulate? This activity, when you'll be visiting the labs, please connect them, and there you'll understand how this been happening. Are we good now? So we can see this superior articulating facet, and now can you see that this is the inferior articulating facet, process and facet. Now we can compare a cervical, a thoracic, a lumbar, and the upper two cervical, which are very different. So these are the different, at least you should have some idea how they look different from each other. Look at it. There are basic ingredients are the same, but there are differences according to the location of these vertebrae, because these vertebrae they have a specific job to be performed. Now let's talk about a rib. Again, for the ribs we have typical ribs and atypical ribs. Why? Because we don't have a rectangular thoracic cage, we have a spindle shape. So to accommodate that, I'm talking about the classic feature of a typical rib. So a typical rib means a rib who has orderly characteristics. So now this is what? This part of the rib goes where? It goes to the vertebrae, and this end goes to the sternum. So we call it vertebral end, and this will be the sternal end. And then head, this part is head, and then this is the neck. After head comes neck. And we talk about a term just right now, we call it tubercle. And then this is where the rib goes, it angles out. So this is the angle of the rib, and this is the common site where rib can be fractured. Rib can be fractured anywhere, but this is one of the commonest site where they can be fractured. And now what is that? This whole long thing, guess. The shaft. And then can you see that there are two lines? So between the two lines there is a space, we call it costal groove. We'll be talking about this when we'll be talking about thoracic wall in detail. And then this end goes for the sternum, so we call it sternal end of my rib. So these are the features. If a rib have all these features, we call it a typical rib. And if a rib is short of any of these features, we don't call it a typical rib, we call it atypical rib. We need to understand that, and how we understand that when we'll be visiting the labs. Please spend time in understanding, in differentiating these ribs who are different from each other, and you should be able to understand how they are different, and you should be able to differentiate these ribs. On look at it, this is where I told you this is the site where it been fractured, most common site for fracture. Now look at it, you are looking at the different ribs, they are different. This is my first rib, look at it, the second rib, from above, from below, and look at it how a rib articulates with a vertebrae. Look at it, this head goes to the demifacet, and if when you see in detail there will be more facets here, there will be a crest in between, and then you can see this tubercle goes here, and this is how we have a joint formed between the vertebrae and the rib. We'll be talking about this when we'll be talking about the thoracic wall in a different way. Look at it, this is a typical rib. It has, look at it, 3 and 3. These are, the head has a crest in between. Then there's a tubercle. Then there's an angle. And then there's a shaft, sternal end. And there is the costal groove. You can see from different angles. And now these ribs, they are entirely different. These are my rib number 11 and 12. They cannot reach to the sternum. So they are very short. And okay guys, so now let's talk about the mediastinum. So what is this mediastinum? Guys, this mediastinum is a really important landmark, and we need to be good about it. So first let's think about it. What is this mediastinum? Mediastinum primarily is a space between the two pleural cavity. And what are these pleural cavity? Pleural cavity are the similar structure like peritoneum, but these membranes, they are covering my lung. We have another set of membranes who cover my heart. We call them pericardium. So between the two lungs and their coverings, the space in the middle, that is called mediastinum. So let's look at this mediastinum on this side view, where you are looking at the vertebrae behind and the sternum in front. So let's look at it. So mediastinum is a region of the thorax between the two pleural cavities and consists of heart and great vessel and major tubes. And what are these tubes? They can be nerves, blood vessels, and lymphatics. And that is really important. I'll be talking more in detail. I have a full lecture on mediastinum and mediastinal shadows, which will be coming up in our coming days. So now, in this diagram, what you are looking at, the first thoracic vertebrae, the fifth vertebrae, and the 12th vertebrae. Below to that, we all know this is the lumbar vertebrae. And now what happens? This is my first rib. Superiorly, look at it. They are not at the same level. The sternum is below. First thoracic vertebrae is above. So it makes a wedge-shaped structure. Because our thoracic cavity is not a cube. It's not a rectangular. It's a cylindrical, spindle-shaped structure. So it has contours. Look at it, it's wedged. And this is the manubrium part, the body and the xiphoid process of what? Of the sternum. And what is that? Diaphragm. Are you good with that? We talk about this is the manubrium sterni, the body of the sternum, and the xiphoid process. Now what happens? The joint between the manubrium and the body, manubrosternal joint or angle of Lewis, important reference point for counting the ribs. We draw an imaginary line which goes backwards, passes between the fourth and fifth thoracic vertebrae, and this line is a divider. We don't see this line. This is an imaginary line, helpful for our better understanding. So this line primarily divides my mediastinum into an area above to it and an area below to it. So we call it superior mediastinum. And what is that? T4. Why I circle it? Guys, this is a very important reference point. So many important events are occurring. Let's say for example, my trachea, it bifurcates at the fourth thoracic vertebrae, and there are so many other things. We'll be talking with the time. So now T4, T5, the level between, and that's an important major landmark. And anything above to that, this green line, we call it superior mediastinum. And below to that, from this green line to this red structure. Below, in front, body of the sternum, behind these thoracic vertebrae. Look at it. It's not flat. It has so much depth inside. So this whole thing is what? My inferior mediastinum. So now heart with its covering start living in this area. So when heart comes here, because of that, it divides this cavity into three. This place is for heart. This is in front and this is behind. So they are part of the inferior mediastinum. So inferior mediastinum by these two dividers is become 3. And what is that? Point A is in front of the heart. It is anterior mediastinum. It is a subdivision of my inferior mediastinum. Point B is my middle mediastinum. And point C is my anterior, middle and what? Posterior mediastinum. Excellent. So now that was an anatomist viewpoint. But clinician has a little difference. What difference they carry? Everything is the same. They don't talk about superior and inferior mediastinum. They say we have anterior, middle and posterior mediastinum. But doesn't matter. Why I'm putting this slide? Just for your reference. Guys, we need to be good at it. This mediastinum is a very important landmark and you are expected to be good with this. So now we should be knowing who lives in these compartments. Why we are talking a lot about them. So now look at it. First, this is the ribs has been cut. The sternum has been cut. You're looking at the clavicles. You can see the lungs. Heart is not visible nicely here. Just here, the heart. And this is the covering for it. We call it pericardium. The lungs, the covering of the lungs has been removed. This is, you're looking at the diaphragm. Are we good? So this space is the mediastinum. I told you, between the lungs. When you'll be coming to the labs, you'll be seeing this. And I'll be demonstrating even in some cadaveric videos for you, and there you'll be looking at this mediastinum. So now you're looking at. So now look at it. What are the contents? How we can understand? So superior mediastinum. What it contains? Great vessels. What are these? Could be nerves. And what nerves? Vagus nerve, phrenic nerve, thoracic duct, trachea, esophagus, a gland, thymus, where it's present in infants. And its remnants are there in adults. Otherwise it goes away, and sympathetic trunk. These are the contents. If somebody asks you, what are the contents of the superior mediastinum? So these are the contents of the superior mediastinum. Anterior mediastinum, who lives there? We have a list of these structures and you need to be good with them. Middle mediastinum, heart and its coverings. You guys, these contents are important and you are expected to be good with these exactly. And the posterior mediastinum, so many important structures, so many important tubes. What are those? Esophagus, trachea. Then we have nerves, arteries, so many important things, thoracic duct, system of veins, and a lot is there. So these are the really important structures. So these are the contents of my mediastinum. So I have shown you what is present in the superior mediastinum. Guys, superior and inferior mediastinum we have talked about. So superior mediastinum, the content of superior mediastinum, don't think they got vanished in these because they passes down. They are passing between these compartments because these are the vertical thing and this is the horizontal thing. So you can find these things also passing through these. Either they are going above, going to the head, or going towards my body cavity. So these are the contents and this is a really important slide. So guys, I hope you will understand things and I'm sure we'll be learning a lot more details about these things. So thank you very much. I'm open to your questions and please feel free to ask if you have anything for you. Thank you very much. Bye bye. Stay blessed.